My name is Dr. Manish Julaha and I practice head and neck oncosurgery. Today I will tell you few facts about head and neck cancers and how to detect them early. So in India, approximately 1 million new cases of cancers they are detected every year. And out of this, one third number, they occur in head and neck, mainly oral cavity and throat. And this is a very big number if you compare with rest of the countries, because head and neck cancers, they account for less than 10% in Western countries and less than 4% in US. So what is the cause for such high number of head and neck cancers in India? It is mainly the use of tobacco. And another sad fact about head and neck cancers in India is that majority of the patients, you can say more than 65%, they present in stage 3 or stage 4. And we say cancer is curable if it is detected early. And when patients present to us in such late stages, it affects all the parameters like overall survival, treatment outcome, side effects, functional outcome, quality of life, everything is affected. And when patients, they come in early stage, the treatment is less invasive with less side effects and the functional outcome is very good and the chances of recurrence, they are very less. So what can we do to detect head and neck cancers at the earliest? So we can do this if we have the knowledge of the sign and symptoms which hint towards the head and neck cancer and by doing self-examination. So what are the early signs and symptoms? They are mainly any ulcer in the oral cavity which doesn't heal in 3 weeks, or any lump in the oral cavity or neck, any red or white patches in the oral cavity, or there may be unexplained earache or nasal blockage mainly on one side and especially with blood-stained mucus discharge. There may be ill-fitting of denture because of any swelling over the gums. So these are the early signs and symptoms. If we find any such thing, we should take expert opinion. And by doing self-examination, we can detect head and neck cancer at the earliest. So I would say all those people who are at high risk of getting head and neck cancer, they should do the self-examination at least once a month. So who are the people who are at high risk of getting head and neck cancer? Most importantly, those who use tobacco in any form like smoking or chewing, then elderly people above the age of 45, and people who have exposure to ionizing radiation in past, and people who have had head and neck cancer in past, they are at high risk of getting the second cancer, so they should also be very careful. And how to do this self-examination? This is very simple. It will take hardly 1 or 2 minutes. To do this, you have to stand in front of the mirror and you have to feel both the lips, the upper lip and lower lip, using your thumb and index finger. Just feel them. And by pulling them outward, you have to see the inner lining of the upper lip and lower lip. And by pulling the lip outward, you have to look at the gums also, the upper gums and lower gums. And using your thumb and index finger, pull your cheek outward and look at the inner lining of the cheek on both sides and look for any ulcer or lump or any red or white patches. And just open your mouth and say ah. And while saying ah, have a look at the posterior part of your throat and also at the roof, mainly the hard palate. And then by touching your tongue on the back of your upper teeth, have a look at the undersurface of the tongue and the floor of mouth, and then pull your tongue outward and look at its upper surface, and by moving the tongue sideways, look at the sides also Again, look for any ulcer or lump or any red or white patches. And you have to examine your neck also. Just by standing straight, palpate below the jawbone and above the collarbones. And by moving your head backwards, look for any asymmetry of the neck. Suppose there is any fullness on either side as compared to the other, there may be some lump. If you find any such thing, just take expert opinion. And thank you very much for watching this video and contacting through Lybrate. Thank you.